my name is Maneet and I am a medical student at St. George's University School of Medicine in Grenada. I thought I would record a YouTube video just going over Term 4, like a recap, some tips, how it's structured, and just anything that I think will be helpful for fellow students. It's going to be kind of similar to my previous term recap videos. So yeah, I thought I would just share some advice, just some things that I thought were helpful, my personal experience, and I hope that this is helpful for you. Like always, if you have any questions or you need any advice or just want to talk about medical school, please feel free to reach out to me via social media or leave a comment and I'll get back to you. Yeah, so let's get started. And I'm going to have my iPad just with everything so I don't forget anything. Term 4 is broken down into modules. There are 4 modules, so there's FTCM, there is CRS, there is RHS, and there is DERS. And so all of the modules, they have a similar structure in the way that they go over all the microbiology, all the pharmacology, and all the pathology related to these systems. So for FTCM, this is Foundations of Clinical Medicine. It is about 5 weeks long, and you're essentially going to go over everything that's like foundation to medicine. So you'll go over all like pharmacokinetics, pharmacodynamics, you'll go over receptors, a lot of skin infections, a lot of healing, necrosis, apoptosis, reactive oxygen species. This is for 5 weeks, and then at the end of you will have an exam per usual. And for term 4, a lot of the exam questions are very third and fourth order questions. So you have to obviously know the content and your lecture slides, but then also be able to apply it. So for these exams, they are a little bit harder in the way that you have to apply it. It's not all memorization. There are obviously a lot of first order and second order, but there's also going to be third and fourth order. So I would just be mindful of that to know how to apply the content that you are learning in more of a clinical setting, but you'll get exposure to this as you go through term 4 through small groups and everything, so don't be too scared. You got this. And then we have CRS, which is cardio and the renal systems. This is 4 weeks. So in the first 2 weeks you will cover cardio, and then in the last 2 weeks you'll cover renal. So for CRS, there's a lot of drugs, there's a lot of pharmacology, and there's a lot of pathologies. There's not as many infections, so you'll notice that most of the time spent for CRS will be spent on the pathologies and the pharm related to the cardio and renal systems. I would advise to know a lot about the connections between the cardio and the renal system. So if something is abnormal in the cardio system, how does that affect the renal system, and vice versa? You'll notice that there's a lot of questions about that when it comes to application. And then also just one really big thing, I would say know the differences between things. So if they teach you one, like for instance, like group of disease, so if they teach you like nephrotic syndromes, know how to compare and contrast them to nephritic syndromes, because you'll notice that they do that a lot, and they'll try to trick you and they'll try to like make it seem like it's one thing, and then they'll add in like one defining characteristic of the other group, and so it's the other group. So just be mindful of that when you're studying. And then after CS, there's RHS, and this is 4 weeks. This is respiratory and heme systems. So it's 4 weeks, so there's a lot of micro in this. So for me, I found that this at the start was a little bit daunting because there's a lot of little things to know about micro. What I recommend is what I did is I would have like a I guess like a Google Doc as I was going through notes, and I would write them out, and I color coded a lot. So like clinical manifestations would be one color, maybe complications would be another, like defining features, like if it's gram negative, gram positive, all that would be another feature. So that's what I found would be helpful. And then I would categorize them in terms of like how they manifested. So if they were like different bugs for pneumonias, I would do that. So for RHS, like I mentioned, please know the differences between like obstructive versus restrictive disorders. So what defines an obstructive disorder and what defines a restrictive disorder, because that I found to be a very, very big part of the exam. So I would do that. And then also for the heme aspect of RHS, know the differences between like all the white blood disorders, and know the differences between all of the RBC disorders, and know the differences between all the leukemias, all the lymphomas, because on the exam, a lot of these things manifest in very similar ways. So you might need to look at the lab values. There might be like one lab value that helps you keen into your diagnosis. So just be mindful of these things when you're studying. Like don't just memorize, be able to compare and contrast to similar things within each system. Moving on to DERS. So this was the last one. So this was 6 weeks. So this was digestion, endocrine, reproductive systems. So this one is for 6 weeks. So once for the digestion aspect, I would say be very strategic when you're studying and know like the differences between inflammatory and non-inflammatory diarrheas. Know all the mechanisms of actions and the adverse effects of all the drugs they're teaching. And then the endocrine repro section was very repetitive of what you learned in term 2 in the ER. So not skip out in DLAs in term 4, because for instance for DERS, male repro was mostly DLAs. And so if you didn't study those and they appeared on the exam because you thought they weren't that important, you're going to be in a little bit of trouble. So I would advise, make sure that although female repro was taught more so in lecture and male repro wasn't, still go over male repro DLAs because they are important and they will show up on your exam. On top of all these exams, you will have OSCE, and then there's also professionalism points that are a part of term 4 that kind of make up your overall grade. So for the OSCEs, I found that the best way to prepare for them was actually all throughout term 4. So when you go to your B-lines with your group of students, please prepare for them. You will know what you're going into, so you'll know what the chief complaint is. So please do a little bit of research. Go over the physical exam that you think will be appropriate for that patient, and look over the PDF that the school provides and try to come up with differentials as to why that may be the diagnosis for this patient based on the clinical complaint that you're provided with. I thought that this was like very helpful, and so when it came down to doing OSCE, it's obviously so stressful. It's not as daunting because you've had the exposure and the experience going through a full encounter. So in OSCE, with the way that kind of structured, you will have 3 stations, and during the station you have 17 minutes. So during this you have to complete an entire HPI, a physical exam, come up with a diagnosis, and then you have 10 minutes for a SOAP note. So I know this seems very stressful. I know it seems very hard, like, oh my god, I don't know how to do this. So that's why I'm saying please take advantage of your B-lines, because get your nerves out, get your initial questions and everything over with during that. So when it comes down to your actual OSCE that is actually graded and marked, you will be prepared and you will be calm and you will be able to do a great job on your patient encounter. So you have one full OSCE at the end of the term, which is the full encounter, 17 minutes, 3 stations. But before these, you will have 2 SOAP note assessments and 1 physical exam assessment. So these are very easy. So for your SOAP note, essentially it's like a group, your entire group is going to do the whole encounter, and then at the end you just have to type up your SOAP note, and your SOAP note is the only thing that is getting graded. So this will happen 2 times during the term, and then you also have a physical exam assessment. So essentially when you go into the OSCE room area, I believe you have 3 stations. The computer outside of the B-line room is going to tell you exactly what you need to complete, and then you just go into the room and you just have to do the physical exam. You don't have to type up a SOAP note, no HPI. So that is like the OSCE clinical skills aspect of the term, and on top, and that is all graded. But your B-lines and your Belford small groups are not graded. These are more so for participation. So for Belford small groups, essentially it's more focused on the pathology. So you're going to have, they're going to provide a set of slides, and you pick a few slides depending on how your group divides them up, and you have to kind of like research on that topic so you become educated on that topic so you can teach it to your whole group. Not anything hard. It usually takes like maybe half an hour to prep. So it's nothing crazy, and these are student led. The facilitators I found for the Belford small groups didn't necessarily teach. There it's like answer questions if students had them, but these groups were more so student led within your group. So essentially you're gonna have to explain like the pathogenesis, the treatment, the complications of whichever disease you're presenting on based on the slides. And you are allowed your laptops for Belford small groups for pathology. However, for your micro and farm groups, you are not allowed laptop, like upload the PDFs online. So I would just go through them and try to kind of get like familiar, maybe go over some topics that you aren't like familiar with, or like you don't know that much information about them, so that when you go to these groups, because you're not allowed to have your laptops or like access to any notes, you have somewhat of an idea of kind of like what you're going to be talking about, have some information. If you have any questions, you could ask those during that time. So for your B-lines that you have, you're essentially going to have patient encounters. So B-lines and small groups alternate. Like one day you might have B-line, and then the other day you'll have a small group, whether that's pathology or micro or a farm. So that's how like term 4 is structured. So for your B-lines, like I said, it's just essentially practice on HPI, physical exam, how to do an encounter, how to take history, all those things. So every week I would advise to sign up for roles. So if you know that you're not very good at HPI, or you're like a little bit nervous, or you're not like confident in it, please sign up here. Get those nerves out during your beeline, so for your OSCE you excel. So that's kind of setup of term 4 in terms of like modules, OSCEs, clinical skills groups, Belford small groups. It seems like a lot, but I promise you, once it starts, you get into the groove of everything. You get into the groove of having lectures every day and a small group or a beeline every day, and you honestly get the hang of it. So you got this. Believe in yourself. So now on to tips, or kind of things that I found helped me succeed in term 4. One thing, like always, I am such a schedule person. So on the weekend, I would see what I have every single day, and I would like write it in my planner. So like Monday I have 2 lectures and I have a beeline. On Tuesday I have a farm small group and I have lectures. That really helped me make sure that I like completed everything I needed for every day and not fall behind. And I also included like what DLAs I needed to do, what lectures I needed to study, if there were any questions, if there was any like extracurricular things that I had to do, just so you're like aware and you stay on track of things. So I found that term 4 was hard, not in terms of the content. The content is very doable. It's just everything that you need to do, like, and attend every single day. So that's why I say time management is very, very important in term 4, especially because if you fall behind, there's so many things that take up your time every single day that there's not as much time to like catch up. And then you obviously want to have a little bit of downtime on your weekends. So just time management. Please schedule, please do what works for you when it comes to time management. Whether that's a daily to-do list, a weekly to-do list, figure out what works for you and stick to your schedule, because you will thank yourself later. In terms of study strategies, stick with your study strategies. Just because there's more content, there's now more like clinical aspect of all the content and all the systems. Do not change your study strategies unless they aren't working for you. So what worked for you in year 1, keep those same strategies if they are working for you, and maybe implement an outside resource. But keep in mind that SGU is making your exams. So SGU is going to take content from your lecture slides and DLAs and things that they provide you with. So I would advise only supplement when you aren't understanding like the basic concept that's in the lecture notes. But please stick to your lecture notes. That is what your exams are going to be based on. They're not going to be based on Sketchy. They're not going to be based on Pathoma. They're not going to be based on medical school boot camp and all the other resources. Supplement with them. Use them as a foundation if your foundation with the lecture notes is not concrete. But please, please, please stick to your SGU resources. That is what will help you succeed, because SGU is making the exams. And like always, please take breaks, especially in term 4. You will notice burnout. I don't think burnout hit me as strong as it did in term 4. So please take breaks. Do something every single day that helps you, that you need to do for yourself. So whether that's like going to the gym, going on a walk, watching some Netflix, FaceTiming friends and family back home, maybe getting a coffee with a friend. Do what works for you and what feeds your soul and fills your cup, because that is so important. Term 4 is long, especially with term 3 was right before, and you have been on the island for so long. So please, please, please take breaks. Burnout is so real. And another thing, like always, for me, I need my sleep. I need my sleep to be productive. I will not stay up to like catch up or finish my to-do list, because then my next day is going to be even less productive. So for me, I had a consistent sleep routine. This just helped me. Doing something for myself every single day and sticking to a schedule is what truly, truly helped me succeed and honestly like enjoy term 4. And also, please always believe in yourself. Know you belong. Know you deserve to be a doctor. You are going to be a phenomenal doctor. Believe in yourself. Do not let imposter syndrome get the better of you. And yeah, know that you deserve this and you've made it this far for a reason. So yeah, that's kind of everything I have for term 4. And if you have any questions, or you just want to talk about medical school, or you just like need help with anything, please, please, please me on my Instagram, my TikTok, and I will try to get back to you. Yeah, bye.